Hello everyone, I am Abhishek and you're watching Vet Study by SAT. Welcome back to our channel, and today we are in the Canine case series and we are posting this case series every Thursday. So let's start with the description. There was a 6-year-old neutered male Rottweiler living in California and was evaluated for a bilateral nasal discharge. The dog was otherwise healthy and it has also been vaccinated regularly and was on heartworm prophylaxis. So physical examination revealed no other abnormalities besides the only one, bilateral mucoid nasal discharge. So rhinoscopy and a brush cytology were performed. Let's have a look at the results of rhinoscopy and brush cytology. So this is the result of brush cytology, and let's interpret this one in very layman term. So there's a hyphae and there are neutrophils. And this is the finding of rhinoscopy. The mucosa are hyperemic, they are edematous, and they are white colored plagues that might be fungal plague. So let's go on to the questions. The questions are: how do you interpret the rhinoscopy finding? How do you interpret the cytological finding in the dog? And what are the treatments considered? So as I've already told you, the mucosa appeared hyperemic. It is edematous and multiple white plague lesions, most likely consistent with fungal infections, can be seen. It is very evident. You can see here in the figure, these are the white fungal plagues, and the mucosa are hyperemic, they are edematous, they are swollen. So rhinoscopy finding reveals these things. So about the second discussion, how would you interpret the cytologic findings in this dog? So there are long septate hyphae that are 5 to 7 micrometer wide with parallel walls are evident, along with admixture of neutrophils. So there are fungal hyphae and surrounded by neutrophils, and these are consistent with the hyphae of Aspergillus species. The most common species that affects the nose of dogs is Aspergillus fumigatus. However, systemic infection are also possible, but in this case there was only nasal infection. And the species can be identified based on their branching at 45 degrees angle, but branching was not observed in this case. It might be because of human error while preparing the cytological slide, or it might be because of any other cause, sampling error it might be. So the most common sign that differentiates Aspergillus-induced bilateral nasal discharge and bacterial or any other infection-induced nasal discharge is that the nasal discharge does not respond to antibiotics. So what we do is we administer the antibiotics because of nasal discharge, suspecting the upper respiratory tract infection, but what happens is it never stops. There's no improvement, there's zero improvement, because antibiotics does not have spectrum for fungus like Aspergillus. So you have to keep in mind, response to treatment might be a way of diagnosing Aspergillus. So this is the depigmentation of the nasal planum because of drainage of mucoid discharge. What happens is the Aspergillus is toxin produced by Aspergillus is responsible for the discoloration of the nasal planum from where the discharge flows. So this is a very, very good clinical finding which helps us to differentiate Aspergillus induced nasal discharge. So before understanding the treatment, we have to understand the anatomy of the canine skull. So the major point I'm gonna mark out here is the cribriform plate of ethmoid bone. So what happens is basically when Aspergillus fumigatus infects a dog nose and sinuses, nasal cavity and sinuses, what happens is it destroys the turbinates, and it might also destroy the cribriform plate of ethmoid bone. So if, for instance, the cribriform plate shown in the figure is destroyed or perforated by the Aspergillus, what will happen is that the meninges will come in contact with the nasal cavity. So there is CSF rhinorrhea, that means the CSF might come out of the nose. And if in that case we go for the treatment, that is, if in that case we do the nasal irrigation of antifungal drugs, then the antifungal drugs will come in contact with the meninges, brain, and it causes CNS toxicity, it causes seizures, and eventually it can lead to the death of the dog. So now let's have a look at the CT scan of the same dog with nasal aspergillosis, and you can see the extensive destruction of turbinates, nasal turbinates, as I've pointed it by arrows. We can also see the compression fracture in the left frontal sinus. And finally, the most important thing, the cribriform plate is intact. So in this case, we can go on with the nasal irrigation treatment. It is relatively safe for that kind of treatment. So the prognosis is good because turbinates are destroyed, but the cribriform plates are intact. So this is a very important diagnostic tool if we are to proceed with the treatment of aspergillosis. And really, you have to make sure to do a CT scan before thinking of any treatment. So let's move on to the treatment of aspergillosis. The first point is clotrimazole or enilconazole. The second point is said that a CT scan should be performed to assess the integrity of cribriform plate, because such drugs can cause toxicity if they leak into the CNS, as I've already told you. And there should be a debridement of all fungal plaques, followed by 1 hour topical treatment with antifungal medication. So for dogs that have a breach in the cribriform plate or frontal bone, or those who cannot tolerate the prolonged anesthesia, for topical treatment, consideration can be given to use of oral azole antifungal like ketoconazole, but it is not efficacious for such kind of invasive aspergillosis. So newer agents such as voriconazole and posaconazole are favored over itraconazole, and fluconazole, which penetrates the CNS, is not active against Aspergillus species. So let's look at the intranasal treatment protocol. We have to fill the nasal cavities and sinus with clotrimazole solution and maintain it for full 1 hour. And for large dogs, we need 50 to 60 ml, and for small dogs, 25 to 30 ml is enough. So when the nasal cavity is full, we have to obstruct the nostril with Foley's catheter, because we have to prevent the solution from draining out of the nose, and we have to rotate the head to improve the distribution and the contact of clotrimazole to the nasal and sinuses. So 1 hour after the treatment is complete, we have to drain the clotrimazole by placing patient in sternal recumbency and removing the Foley's catheter obstruction, and we have to let the solution drain rostrally. And finally, after the solution is drained, visible solution is drained, we have to irrigate the nasal cavity and sinuses with saline to ensure that no drug remains to be swallowed when the dog's awake. So what happens if the dog swallows the remaining solution of clotrimazole? It might lead to megaesophagus. And so we have to remove the pharyngeal and nasopharyngeal gauze through the mouth and ensure that no clotrimazole is left in the pharynx or in the nasopharynx. So if, for instance, it causes pharyngeal and laryngeal irritation post-recovery, so we have to treat it with steroids. Like we have to give prednisone 0.5 mg per kg body weight. We can give it for 1 dose, or if the irritation persists, we can give the declining dose of prednisone for 3 days for once a day. So here in this figure, trephination is done. That means boring a hole into the skull, into the frontal sinuses, for irrigating it with clotrimazole. So this was done by using bone marrow needles into the frontal sinus for irrigation with clotrimazole in a dog with intracerebral nasal aspergillosis. So this ensures proper contact of drug with the fungus in the frontal sinus. This is a very good technique. So next on we have the budding heads and microconidia of Aspergillus on cytology. So this is a typical demonstration of Aspergillus species, Aspergillus fumigatus species. But previously in this case, on brush cytology, we only saw some hyphae, that was not specific for Aspergillus because there were no branching at 45 degrees angles, or neither there were microconidia. So we suspected it for Aspergillus and started the treatment after a CT scan. So we have to take some precautions, and we have to be aware about some drug interactions before starting the treatment. So clotrimazole 1% solution contains PEZ and isopropyl alcohol. They are irritants. It can really irritate the mucous membrane, and it also has been associated with megaesophagus in some dogs if it is swallowed, so as I've already mentioned earlier. And solution that contains propylene glycol, it can cause pharyngitis, laryngitis, esophagitis, and it should not be used. Ensure that all clotrimazole has been drained out of nares before recovering dog from general anesthesia. So you have to protect the eyes during the procedure. We can use tapes to close the eyes, or we can use coating of paralube or antibiotics ointment in both the eyes to protect the harmful substance from coming into a direct contact with the eyes. So that was all for today, and it was a very interesting case. I know you guys will find it a very interesting case. It's really fascinating. So this is it for today, and I hope you loved the video. I hope you liked the video. I hope you enjoyed the video, and please don't forget to subscribe our channel and help us to grow together. So that was it. Thank you, and keep watching SAAT Center. Keep updated every Thursday for such interesting case series. Thank you.